Hi, my name is Sarah, and I'm a primary nurse here at the Durham Regional Cancer Centre. On behalf of our healthcare team, I want to welcome you to our After Cancer Treatment teaching. We have asked you to watch this presentation because you have just finished cancer treatment. What happens next in your care and how often you come back to the Cancer Centre for follow-up appointments is different for every patient. We know that you have questions and concerns about what the next step in your care will be. This is normal. In this presentation, what we talk about is your new normal, the next steps in your care, your side effects, and your worries and fears, what you can do to live a healthy lifestyle, resources and supports available to you and your family members. You can live well after finishing a cancer treatment. We're here to help. This booklet has more information about what we are talking about today. You may have already have a copy of it, or you can also find a copy on the Canadian Cancer Society's website under Publications. In this short video, Judy, one of our patient advisors, tells us what it's like and what it was like for her when she finished her treatment. Each person's experience is different, but you may have some of the same feelings and emotions that Judy had.
The day that I finished chemo, I can remember being elated and so fearful because I didn't know what was ahead. I was really tired. I was exhausted. My arms were bruised from all the treatments and blood work, and I was a changed person.
It is normal to have mixed feelings and emotions at the end of your cancer treatment. You might have feelings like happiness, worry, sadness, or confusion. You may feel happy and relieved that your treatment is over. You may worry that your cancer will come back or get worse. You may have concerns about the way you look. You may feel sad when you think about the changes you've been through, and you may think that you did something to cause your cancer, or you may feel guilty because you have finished your treatment and others haven't. Cancer can leave you feeling confused and unsure about your future. You may feel angry about how cancer has affected your life. You may not have any strong feelings at all. Connie, another one of our patient advisors, shared what her experience was like when she finished her treatment.
Last treatment was great. It was nice to know that you had something to shoot for and get to that point. But the strange feeling is that you don't have that attention anymore. And I know that's awkward to say, but there's so many people on your side and you have a routine and you're doing all these things and people are calling you and people are coming to visit you and then all of a sudden all that stops.
The end of treatment is a big event for most people. The weeks and months of coming to the Cancer Centre on a regular basis are over. You may think that you should celebrate, but you may not feel like it. You may still feel tired and weak from treatment. You may feel abandoned by your healthcare team. All of these feelings are normal. Your feelings may change by the day or hour. Everyone has a different experience. During treatment, it is normal for you to look forward to finishing treatment. You and your family may expect to go back the way it was before you had cancer, but recovering from the cancer treatment takes time.
You're a totally different person. So unfortunately, who you were before you had cancer, and I realize a lot of people that have cancer say this, but that whole life is gone. That's kind of you before, and then you have to start again. It's a brand new life. You're a brand new person because you're a person that has had cancer, and it's a whole new outlook on life because it's kind of like a grieving period for yourself, who you used to be, and now you're a different person. So you need someone to help you graduate into that new person, and that includes work, that includes family, that includes your social life, because you have a whole new group of friends as well. You have your cancer friends now, and you have your family friends, or family and friends that helped you through this situation. You have the ones that didn't, who left. That's that to organize, because people either run to you or run away from you. There's a lot of different things that you have to sort out after you're better, after you're done all your appointments. So there's a real gap between those things.
Having cancer treatment changes your life forever. You may find that you can't or don't want to go back to how life was before your treatment. You may feel differently towards life. It's not so much getting back to normal as it is finding a new normal for you now. Being open to finding a new normal can be helpful. This is a new beginning for you. You won't be coming to the Cancer Center as often for appointments. This may be hard for some of you. You can still call us if you have a concern or a question. We are still part of your healthcare team. Everyone's healthcare team looks different. Your healthcare team might include your healthcare team here at the Cancer Center, your family doctor, or other members of your healthcare team, such as physiotherapists, massage therapists, naturopathic doctor, etc. And your community support, such as Hearth Place Cancer Support Center, support groups, church or social groups, and so on. You will need to make an appointment to see your family doctor to plan how often you need to be seen. Talk to your family doctor about what routine cancer screening you need to do, and this in addition to follow-up you'll need to be at your cancer center. It is important for you to keep track of the information you have been given about your cancer treatments, and the plan for your next steps of care. You may have already been keeping track of this information in MyChart or in a book or journal. It's important for you to share this information with the members of your healthcare team outside of the Cancer Center. You will be coming back to the Cancer Center for follow-up appointments. When you come for your follow-up appointments, you will check in at the computer and do your Symptoms Matter questionnaire. You may have blood work or tests. You'll be seen by your doctor and a nurse. We want to know if you have had any changes in your health or medications, and about any side effects that you may have. The nurse will take your vital signs and weigh you. Your doctor will talk to you about the results of any blood work or tests you've had. The doctor will also talk to you about the next steps in your care and give you any prescriptions you need. You will leave with your next appointment. Every person has a different cancer experience. Your diagnosis, treatment, and your experience with symptoms is also not the same. You may have symptoms for different reasons. You may have symptoms that are caused by your cancer, side effects from your cancer treatment, your medications, or from another health problem you live with. It is important you do the Your Symptoms Matter questionnaire each time you see a doctor at the Cancer Center. We also want you to tell us about other symptoms or side effects you have. This will help us plan your next step in care and talk to you about what you can do to manage your symptoms. You can talk to your oncologist at your follow-up appointments or make an appointment to see your family doctor. Today we will talk about some of the more common side effects from treatment that you may have and how they can be managed. You may have side effects or you may still get them. Some side effects go away after a few weeks, while others last longer or may never go away. Your overall health can affect how long they last. You can find more information about how you can manage your side effects and other symptoms by going to the Cancer Care Ontario website. Fatigue is a feeling of tiredness or exhaustion that doesn't go away. It is the most common side effect. You can feel it physically, emotionally, or mentally. It does not go away with more rest or sleep, and it can make you feel frustrated. You may find it hard to do the things that you want to. The first year can be the hardest. This is different for everyone. At your appointments with us, we may talk to you about having more blood work done, your medications, how you're taking them, and seeing a dietitian, a physiotherapist, occupational therapist, or mental health care provider. There are things you can do to manage your fatigue. You can help save your energy by planning your activities for when you have the most energy, letting others help you, choosing to do things you enjoy, doing only the things that you need to do, and sitting on a chair to wash the dishes or shower, going to bed at the same time every night, or taking short naps during the day if you need to. You can also reduce your fatigue by managing your symptoms and having a healthy lifestyle. We'll talk more about this later in this session. You may have pain that is caused by your cancer treatment, or from other health problems you have. Pain can cause you to hurt, feel uncomfortable, or suffer. Only you know how much you can feel and how it affects you. You may have pain all the time or only sometime. Some people want to reduce their pain as much as possible, while others want to feel well enough to work or exercise. You do not have to accept pain as a normal part of living, as it can be managed most of the time. It is important for you to work together with your family doctor to manage your pain. Managing your pain can help you sleep and eat better, enjoy time with your family and friends, and do work and hobbies. We want to know if your pain changes or if you have a new pain that might be caused by your cancer. Medications are one way to manage your pain. It is important for you to take the medications as they have been prescribed for you. Tell us about any new pain you have, or if it has changed, or if it's not well managed. Regular activity and exercise can help you manage your pain. It may also help if you talk to someone, listen to music, do deep breathing or relaxation exercises, or even watch a funny TV show. We may suggest that you see another doctor, a physiotherapist, or occupational therapist. There may be other programs in your community too. Not all of this care is covered by OHIP or your private insurance. You can find a copy of this booklet on the Canadian Cancer Society's website under publications. Next, we're going to talk about memory or concentration changes. It may be hard for you to remember things or find the right word to say. You may feel that you can't always think clearly. This is often called brain fog or chemobrain. This side effect does not usually get worse, but gets better over time. It's normal for you to feel anxious or even depressed. This can make it hard to concentrate. Ask yourself if this is how you feel. Your memory and concentration changes may also be caused by your cancer treatments, medications, alcohol or recreational drugs, hormone changes, and fatigue. You may find it helpful to put reminder notes on your fridge or mirror, or just use a calendar or a day planner. Plan what you want to say, reduce the number of distractions in your life or at home or in your workplace, do only one task at a time, and learn ways to manage your stress. Keep your brain active by doing crossword puzzles or other kinds of games and activities. Tell your family and friends about the problems you're having with your memory or concentration. Others need to know what you're experiencing. There may be helpful supports available to you in your community. Hearth Place Cancer Support Center offers a class on cancer-related brain fog. This class will give you information on what you can do to cope with this side effect. Lymphedema is caused by a buildup of your lymphatic fluid when your lymphatic system is damaged. This damage can be caused by the surgery or treatment from radiation that you were given for your cancer. This leads to swelling in your tissues where the lymph flow is blocked. Swelling may be in your arm, your leg, or can also be in your breast, genitals, head, or neck. You may already have lymphedema. If not, it may become a problem for you years after your treatment is finished. It may or may not ever go away. You may have lymphedema if you have any swelling, a feeling of heaviness, clothing, shoes, rings, or watches that feel tight, pain that might feel like aches, shooting pain, or pins and needles, less joint movement or flexibility, infections in your skin that don't go away or keep coming back, It is important for you to talk to your family doctor if you have any of these symptoms. You may be seen by a physiotherapist or a certified lymphedema therapist. This care may not be covered by your OHIP or private insurance. There are exercises that can help with the flow of lymphatic fluid. There are also special bandages, sleeves, and stockings that may be prescribed for you. Hearth Place Cancer Support Center offers different programs that may be helpful to you. You can also find more information about lymphedema and how it can be managed on the Canadian Lymphedema Network website. It is important that you take good care of the body part that may have been affected by lymphedema. There are things you can do to help yourself, such as keeping your body clean and dry, putting on moisturizer creams or lotions, protecting your affected body part from constant pressure, such as tight clothing or having your blood pressure taken, protecting your skin from cuts, sunburns, bug and animal bites, and watching for signs of infection. Exercising regularly, eating a balanced diet that is low in sodium, having a weight that is right for you and is also helpful. Elevating part of your body that is swollen for a period of time that is comfortable for you, and changing your position regularly.
Hi, I'm Belinda, and I'm one of the social workers here to talk to you about your worries and your fears. Every person has a different cancer experience. Your diagnosis, treatment, and your experience with symptoms is also not the same. It is normal to worry about your cancer coming back or spreading. The problem is that worrying doesn't help. Thinking about the things that could go wrong doesn't stop them from happening. It only stops you from enjoying the good things in life. It uses up your energy and interferes with your day-to-day life. There are triggers that may cause you to worry, such as feeling sick or having symptoms similar to when you were first diagnosed, appointments with your doctor, tests, scans, or procedures, hearing that someone you know has been diagnosed with cancer, anniversary dates, like the date of your diagnosis or the date you started or finished treatment. Your fears and worries about your cancer should become easier to manage, but they may never completely go away. It's important for you to know what your triggers are. Having a plan to manage your worries can stop you from having them. Being in denial about your worries, hiding your feelings, and isolating yourself can cause you to build up your emotions and make your worry worse. If you are daydreaming or always thinking about what ifs and worst case scenarios, worry can become a problem. Worry can keep you from enjoying the good things that you have in your life, lower your energy level, and cause you to have problems with anxiety or depression. The good news is that you can learn how to break this worry habit. You can train your brain to manage some worry. There are activities that you can do to help with this. You can help yourself by becoming okay with not knowing. It is not possible for you to know with 100% certainty what is going to happen in your life. You may find that getting back to your normal activities and making changes in your lifestyle is helpful. Setting a daily schedule can give you a better sense of control. Set aside time in your day to worry. Instead of trying to stop your worries, let yourself have these thoughts, but put off thinking about them until a later time. Challenge your worrisome thoughts. Be hopeful instead of thinking the worst. Ask yourself, is it likely that what I'm worried about will happen? Is there a better way to look at my situation? What would I say to a friend who had the same worry? While no one can control every thought or worry, it can be helpful not to dwell on the fearful ones. It can also be helpful to distract yourself by going for a walk, calling a loved one, reading, or using a relaxation technique. Set goals for yourself. It can be helpful to think about what is important to you and to set goals for your life after cancer treatment. What can you hope and plan for? Remind yourself that you deserve to enjoy your life. Share your worries. Talk to your feelings. Talk with your friends, families, anyone who has finished cancer treatment, your doctor or a social worker. If you don't feel like talking about your feelings, write them down in a journal. Although it can be hard to think about You may want to prepare yourself for the possibility that your cancer might come back or spread. There is also no need to worry unnecessarily. It is important for you to understand your cancer diagnosis and the type of treatment that you had. Get accurate information about the risk of reoccurrence for your cancer. Know what symptoms to look for, and keep up with regular follow-up visits. Take time to find what works for you. It is important to talk to your healthcare team if you have one or more of these problems for longer than 2 to 3 weeks. You are constantly worried about your cancer coming back or spreading. You are having problems sleeping. You have little or no appetite for days. You are staying away from your family and friends. You have no interest in activities you usually enjoy. You have feelings of hopelessness, or you are feeling like a burden to your family. You can talk to a social worker about what you can do to manage your worries. Worrying about cancer reoccurrence can take up a lot of your time and make you feel stressed. It can help to think about how you can face your fear of your cancer coming back or spreading. Ask yourself, what do I have control over? Although you do not have control over what the results of a test might be or a scan might say, is there a reoccurrence or spread? You do have control over how you spend your time and what you think about. You can choose your thoughts like you choose your clothes. Ask yourself, what were my previous symptoms? Or what are common symptoms with my type and stage of cancer? What did the doctor tell me to watch for? Keep track of your symptoms. If you have them for more than 2 weeks, call your doctor. Ask yourself, what would you do if your cancer came back or spread? What plan and supports would you need in place to help you cope? Use thought-stopping techniques or other coping strategies. To adjust to your new normal, give yourself and your family time to get used to new feelings and situations. Be honest about your feelings and the needs that you have. Let your family and friends help. Connect with other people that have been through cancer treatment. Set personal goals for living with cancer or life after cancer treatment. We all need to set goals. Goal setting can give you direction and control. What can you hope for? What can you plan for? What can you do to be as well as possible, lessen your side effects, or even prevent or reduce the chance of reoccurrence? Most people would like things to return to normal, but for many, a new normal means a change in everyone's expectations. You may have other worries or concerns that we have not talked about today, such as finances, other side effects, or intimacy and sexuality. Please let us know if you have any of these worries or concerns. You can obtain a copy of the booklet from the Canadian Society websites or under our publications. Having cancer can change the relationships that you have with others. It is normal for some relationships to become closer, while others may become more distant. Your family or friends may become overprotective. Your family or friends may be unable to give you the support that you want or need. Problems that you had that existed in your relationships before your cancer diagnosis may still be there, or new ones may have started. The way in which your family works may have to change permanently. You may have to find new and different ways to do things. For example, if you used to be the one that did the cooking or the yard work before your treatment, you may find that these jobs are too much for you now, so someone else may have to take these things on. To help yourself and your family, talk to your family and friends. Let them know what you can and cannot do. If you are hurt by what others say or do, talk to them about your feelings. Give yourself time. For example, if you have children, let them know that it may take a while for you to have the energy to do what you used to do. Have a talk with the social worker about what you can do to help with the problems that may exist in your relationships. After your cancer treatment is finished, you may have questions about what to do next. You may be wondering, can I go back to work? Can I start school again? I want to give back. Where can I volunteer my time? Working is an important part of life for many people. Because of your cancer treatment, you may have had taken time off of work and you may not have kept working. Returning to work after finishing your treatment for cancer can be difficult. Andy, one of our patient advisors, shares with us what his experience was like when he went back to work after finishing his treatment. Each person's experience can be different, but you may have some of the same feelings and emotions that Andy had.
My ESAS got progressively worse with regard to stress, sleeping, exhaustion, etc. So it really did indicate that. One nurse who I admire highly at this hospital for the couple interactions I had with her, asked me if I wanted to see a social worker. I didn't understand what the social workers did. And I felt it was kind of throwing the flag in to go see a social worker about my stress at work. And I didn't quite see them helping accommodate me or give me any tools to address my work stress. So I declined at that time. I then went through a series of episodes with at work that put me in an extremely bad, agitated state. And it was at this point in time that I realized I needed to do something about it. And I really didn't want to quit. And I didn't feel I should have to quit work just because I had cancer. So I then made an immediate appointment with a social worker, and she was very understanding and took me through some things and suggested I meet with my family doctor, which I did, and my family doctor picked it up and ran with it from there.
You may or may not be able to go back to the job you were doing before. This can be very stressful. You can talk to a social worker to find out about the government programs that may be available to you. Some of you may be going back to school. This transition can also be physically and emotionally tiring. It's important to be prepared for this change too. Some of you may have a desire to give back. You may want to volunteer at the Cancer Center, join a patient and family experience advisory group, or become a peer support volunteer. You may want to keep your volunteer or charitable work separate from your cancer experience. Before you return to work, school, or your volunteer work, you may want to increase your energy level by doing regular activity and exercise. Make a plan for returning to work or school. You may want to meet with the workplace, school, or volunteer coordinator to talk about what this could look like for you. Give yourself time to adjust to doing the things at your own time, at your own pace. Know that some parts of your day may need to change, such as the hours that you work or what you are doing. Remember, it's your decision when and how you will tell people about your cancer experience. You may decide to not talk about it at all. We will now watch a short video where our dietitians talk about what you can do to have a healthy lifestyle.
What does a healthy lifestyle mean to you? It means working towards having a healthy body weight, eating more vegetables and fruit, exercising most days of the week, drinking less alcohol, and not using tobacco in any form. Living a healthy lifestyle can increase your strength, improve your immune system, and reduce your risk of other health problems, such as diabetes, heart disease, and other cancers. Living a healthy lifestyle can also help you to manage your stress and anxiety, reduce your level of fatigue, and enjoy life more. Research shows you can reduce the risk of your cancer coming back by keeping a healthy body weight. You can also reduce your risk of getting another cancer or chronic disease. If you have questions about what a healthy body weight is for you, ask a member of your healthcare team to refer you to a dietitian. To have a healthy body weight, it is important for you to eat a variety of colorful foods in 3 to 4 meals a day and eat less foods that are high in calories, such as fast foods, sugary drinks, and snack foods. Be sure to eat slowly and exercise most days of the week.
What does a balanced diet look like?
For a well-balanced diet, it's important for you to eat more vegetables, fruit, and whole grains, along with a small serving of protein. The best way you can do this is to fill 3/4 of your plate with vegetables, fruits, legumes, and whole grains, such as quinoa, barley, and rice. Vegetables, fruits, legumes, and grains give you energy and protective nutrients, such as antioxidants, that can help to reduce your risk of getting cancer or other chronic diseases. It's also important to include a protein choice with each meal. When planning meals, choose red meats, such as beef, pork, and lamb, no more than 2 times a week, and don't eat processed meats. Plan meatless meals more often, such as vegetable tofu stir-fry, bean soup, or bean burritos. Many of us enjoy adding salt to our foods, but too much salt can be harmful to your health, increasing your risk of high blood pressure and some types of cancer. You can reduce the amount of salt in your diet by making your meals at home, eating less processed foods such as canned soup, frozen dinners, and prepackaged items, using lemon juice, vinegars, spices, and herbs instead of salt when preparing meals, and eating less salty foods such as potato chips and pretzels. When you go shopping, look for these words on the labels: low in sodium, salt-free, or reduced sodium. Keep in mind, eating and enjoying your meals can be an important part of your social activities and celebrations, and therefore, moderation is key to enjoying a balanced lifestyle. Natural health products are vitamins, minerals, herbs, and other supplements that you may take as a natural medicine, in addition to what you get from food. There is limited and conflicting evidence that natural health products give you the same anti-cancer benefit that a healthy diet does. Some supplements may increase your risk of cancer, may cause you to have side effects, and may interfere with other medications you are taking. Overall, food is your best source of vitamins, minerals, and many other protective cancer-fighting nutrients. In fact, the nutrients found in foods are digested and absorbed easier than the vitamins and minerals found in natural health products. There are exceptions to this. Your doctor or dietitian may tell you to take vitamin D and calcium for your bone health, iron or vitamin B12 for the treatment of anemia, or other vitamins if you are not able to eat a well-balanced diet. More research is needed in this area, and these recommendations may change in the future. If you choose to take natural health products, it's best to talk to a healthcare professional who is registered, such as your family doctor or specialist, your dietitian, pharmacist, or naturopathic doctor. There is research to show that being physically active may reduce your risk of your cancer coming back or of you getting another cancer or chronic disease. Plan to exercise at least 30 minutes a day for most days of the week. Start slow and gradually increase the length and time and how often you exercise. Over time, you may be able to increase your exercise to 60 minutes a day. It is okay to break up your exercise. For example, do 2 15-minute walks each day instead of 1 30-minute walk. If you miss a few days of exercising, don't be hard on yourself and give up. Forgive yourself and get back on track. You don't need to join a gym or purchase expensive exercise equipment. Consider walking or using an exercise DVD. Reduce the amount of time you spend sitting, such as watching TV and computer time. Before you start to exercise, talk to your family doctor or oncologist about what is right for you.
There is a difference between complementary and alternative therapies. You may have used complementary therapies during your treatment. Alternative therapies are used instead of regular cancer treatments. For example, if you used meditation before radiation therapy to help with anxiety, you were using meditation as a complementary therapy. Choosing meditation therapy instead of radiation therapy because you believed it would cure your cancer is using meditation as an alternative therapy. Good scientific research has not yet shown that alternative therapies are effective or safe in treating cancer. Choosing to use an alternative therapy can have serious health effects, such as the cancer spreading or getting worse. Some complementary therapies can also affect or interfere with your regular cancer treatments. It's important for you to consider what you hope the therapy will do for you, what the qualifications of the therapist are, what the therapy claims to do, the possible side effects of the therapy. We need to know if you are using or thinking about using any complementary or alternative therapy. It is also very important your complementary therapist knows that you've had cancer treatment. You may have more questions about complementary and alternative therapies. You may find more information on the Canadian Cancer Society's website. We have given you a lot of information today. Even small changes can help you to improve your overall health. It's important for you to set realistic goals, give yourself permission to make mistakes, take small steps, know that some changes happen slowly, and to be patient with yourself. You can find support in your community. It may take time to develop these connections. Some people want to cope on their own, while others like to talk about their experience. You will need to find what approach works best for you. It may take time for you to find the right program or support that is helpful to you. Here are some suggestions. You may have been part of a support group when you were going through treatment. If not, you may want to think about it now. There are many support groups for people at the end of their treatment. You can learn from the experiences of others, and they can also learn from you. You may also find it helpful to talk with others who have finished cancer treatment. Finding someone to talk to who has been through the same experience can decrease your sense of isolation. You may want to talk with a social worker at the cancer center about what you can do to manage your feelings. The social worker can help refer you to a counselor in your community. Online supports can help you and family members share your experience and build supportive relationships. Wellness programs can help you build or retain strength, balance, and energy. For example, yoga, walking, and other exercise programs. You know what kind of support works best for you, and it can help to try new and different ways to get the support that you need. Hearth Place Cancer Support Center is just a few blocks south of the Cancer Center. It offers a home-like environment, and parking is free. They have support groups and wellness programs that may be helpful to you and your family members. The programs offered are for men, women, and children. Hearth Place also has after-treatment programs that can help you move forward in life after your cancer treatment. For more information about their programs, see their website at www.hearthplace.org. Here are some credible websites that other helpful information and support. Talk to a member of your healthcare team if you have any questions about the information given to you in this presentation. Thank you so much for joining us.